Welcome to all listeners. Now, adolescence. The term when we hear, we know that what comes in our mind. That is growth spurt, some biological changes, so different things comes upon. In today's session, we are going to discuss about the contemporary issues affecting adolescents. Today, we have with us Dr. Daisy Thomas, who is the acting principal of Rajkumari Kaur College of Nursing, and she served in other capacities like the registrar of this Delhi School of Nursing,
Delhi
Nursing Council. She served as the registrar. So, welcome, madam, to this session. And before starting the discussion, let us have some brief overview of the topic, that is contemporary issues that affect adolescents. And more than that, this topic is related with the course BS 1-to-1 Childhood and Growing Up, which is part of the B.Ed program. And handling adolescence is very difficult thing, whether it is parents or teachers. And when we look at the term adolescence, we can see that there are different perspectives that we can see. G. Stanley Hall is considered as the scientific father who studied about the adolescence. And his point of view, it is based on the biological viewpoint. But when we look at the Margaret Mead studies, we can see that researcher did in the perspective of socio-cultural. So we can see that the different perspectives of adolescence. So let us enter into the topic, that what are the problems. And many problems like bullying, internet addiction, suicide, then this teenage pregnancy, sexually transmitted diseases. So this will be the focus of this session. So Dr. Daisy, could you explain what is the meaning of bullying and how does it affect adolescents?
Yeah, there are out of various contemporary issues among the adolescents, bullying is one of them. Bullying means it is a form of aggressive behavior among the adolescents. Either they will be doing intentionally, and it has been repeatedly, it is causing an injury to the other person, that is especially the mental injury, and it is causing discomfort among the adolescents. That is termed as bullying. And for example, when we take it up, bullying means when another child is bullying regarding the overweight of the child, or bullying for the skin color. These things will cause an mental agony or discomfort in the child who is being bullied. So there are different types of bullyings are there. That is verbal bullying, physical bullying, emotional bullying, and cyberbullying. What do you mean by verbal bullying? Verbal bullying means when hurtful words are being spoken about an individual, as I have quoted in the example, when they are bullying for the overweight or for the skin color. That is type of verbal bullying. And physical bullying means when a person you are hurting a person or harming a person, or you are causing harm to the physical belonging of that person also, then it is termed under physical bullying. Emotional bullying means when the person is being socially isolated from the group. That means social bullying. The person is kept aloof. They are not being included in the group. That means social bullying. Nowadays, there is cyberbullying are also coming up, where the hurtful online messages are being sent, and there are various hurtful texting messages are being exchanged, which causes online harassment. This is also another type of bullying. And this, as you have asked, that there are various effects are there due to this bullying. The studies have shown that because of this bullying, the person you can see that studies have shown around 2 to 9 times the child who are being bullied have a tendency of attempting suicide. So that is grievous the problem is. So, and it has so much of effect on the adolescents due to bullying. They can have short-term effect or long-term effect. What are the some short-term effects? Like the person entire behavior may be changed. They may become more violent, having more aggressive type of behavior may be shown. They may be angry with others. They may show depression. They may show anxiety. Even sometimes they may keep themselves aloof. Loneliness may be experienced or low self-esteem. Even these children may have lack of sleep. Because of that, even various types of physical illnesses can be present in them. Even because of this, they may not be able to do well in their academic performance also, because of which even they don't want to come to the schools and they remain absent, is again resulting into falling in grades and isolating themselves and not having interest in anything. They may not be participating in the extracurricular activities. They may have disinterest in their social activities, even with the internet use also. Even these children may have suicidal thoughts. So this is grievous the problem of the bullying. What are the long-term effect? Long-term effect is that because of this mental agony or discomfort the child is experiencing, they may not have a proper social development skills. They may not be able to develop. Mental itself may not be that proper. These victims may develop a unhealthy relationship. There is a tendency of creating so much of violence, and they may become physically aggressive in their relationship with others. And even if this cyberbullying, even if the person is not able to see face to face, then also it is equally damaging socially and emotionally. So this type of short-term and long-term impact can occur because in the adolescents due to bullying. Even it is seen that studies have shown that so many the shooting cases we have been hearing through the newspapers, like around 12 to 15 schools where shooting cases have been seen, where the shooters have an history of being bullied. So it is very important we have to stop bullying. And yes, bullying is a problem. It is important that we are able to handle this problem effectively. If it is left unattended, it can cause significant hurdle in the development of the child. So it is important that we have to, as parents, as teachers, as society, we have to take immediate intervention to stop bullying also.
So Dr. Daisy has clearly explained about the bullying, what are the different types of bullying. So when we look in today's digital world, we can see that this bullying is happening every day because of this cyberbullying. And when we look that it affects the socio-emotional element of the adolescents, and which requires a long-term remedy for that in order to overcome them. And in this context, could you please suggest the ways how the school authorities can handle the issue of bullying?
Yeah. So it is the role of teachers are there in stopping this type of bullying, it is important that they should never discourage any child who are reporting the bullying. So teachers, it is important from teachers' side that they should encourage the child to report about the bullying. Then only they will come, teachers will know about the problem which is going on, and then only they will be able to address them. So we have to encourage them to report about the bullying and never dismiss the complaint of the bullied, because it is important that we have to properly note it, what all problems had happened, how it had happened. We have to clearly make the note of it so that we are able to handle the case effectively. And also it is important that in a school there should be a proper policy should be framed up regarding the bullying. The school should have a proper policy framed up. If a person is been found bullying, what is the punishment the person would be getting? That the children must be aware about. Then only once they are aware about the things, then only they will not practice this type of things. So it is important that a proper policy should be framed up against the bullying and make the children aware about it. And also it is important that we have to counsel the victim. It is important that we have to reassure them and give the proper protection so that they develop a confidence, and they are because we don't want they should not retaliate with violence, because sometimes it happens that they retaliate the same thing with violence or aggressive behavior. That's why we have to counsel the victim and support them psychologically so that they are able to have a proper mental development can take place. It is also important that we have to deal firmly with the bullies who are doing the bullying. We have to even deal very firmly with them. We have to tell them, yes, it is not acceptable act. We have to sternly and inform them, and also without any physical punishment. Even physical punishment will not be effective for the bullies also. It is firmly and effectively informing about the policies and telling them firmly that this type of behavior is not acceptable. Then also it is important that we can encourage teamwork. Through teamwork, what happens that we can form a team where the victims have a company of the children who are not bullying each other, so that they are able to have a healthy company, the company of healthy children who are able to communicate each other effectively. Then it is also see that if there is a group who keep on bullying others, we have to see that we break this gang. Yes. So once we break this gang or segregate these gangs, then they may not be individually, they may not be able to do well. So break the gang that bully and segregate the members into different teams. Also, it is important that we should discuss the matters with their parents of the persons who are bullying others, and also with the victims. So both the parents, we have to talk to them, counsel them, so that these type of things does not occur among the adolescents.
So we have seen how to handle this bullying, and it is the duty of the teachers as well as the parents. And more than that, I would like to add that the peer group, that we have to counsel them also, what is their role, how they can help them in a positive way in the midst of these contemporary issues which are increasing among the adolescents. Normally, the second thing what we can see is that many of the adolescents, or whether they are adults also, we can see they are using the substance. Using is not a problem, but when it goes in the abusive manner, it's become a problem. So could you please explain what is the meaning of substance abuse? How is it different from substance use?
Yes. Like when we talk about substance abuse, what do you mean by substance abuse? Substance abuse means it is the illegal usage of the drugs, or using the over-the-counter drugs or alcohol for the purpose other than where it is used for, or in the excessive amount. When it is being used, then it is termed as substance abuse. Or when the usage of drugs in a harmful way it is being carried out, then it is also termed as substance abuse. Or we can also term it as drug misuse. Like this substance abuse is one of the again a contemporary issue among the adolescents, because it can lead to social, physical, emotional and job related problems. And yes, it is a worldwide public concern also, because the youth initially they take it for fun, and then subsequently they are influenced, the drugs that influence their life, and they become addicted to it. And this drugs also, it comes under the punishable act. The consumption of drugs is punishable under section 27 of NDPS Act. So the government also is taking initiatives for this type of substance abuse. So this consumption of the drugs are also a punishable act. As
Yes.
the difference you were asking for it, the difference between the substance use and substance abuse, the difference is mainly because of the strength, frequency and intention of consumption. When it is being consumed in an excessive amount, or there is an increased frequency of consumption is there, or you are consuming the drugs which are heavily potent drug, then it becomes as a drug abuse. And because of this drug abuse, the persons can become addicted to it also. Drug use means when it is taken up, the drugs have been taken up in a comfortable level, then it is termed as drug use.
So very clearly you have explained about what is substance use and abuse and the meaning of this substance abuse. Abruptly, nobody will fall into the habit of using substance in an excessive manner. There are various factors responsible for this type of behavior. Could you please highlight the various factors that lead to substance abuse among adolescents?
Yeah. Before we go into the substance abuse, we can just see what are the common drugs which are commonly used in India, where the people they consume as substance abuse. They are like cannabis and its products like bhang, ganja, charas, and these tranquilizers. Tranquilizers are used for inducing sleep and all, hypnotics and sedatives. It is barbiturate also is used as a sedative. Then amphetamines, these are central nervous stimulating drugs it is, but when it is taken in excessive amount, it becomes as a substance abuse. Then there are other commonly used drugs are like narcotics are there, opium, morphine. These are opium, morphine and used for as a painkillers also. And this tobacco and like cigarette, BD, hookah and other substance like alcohol, and some inhalants can be there like gasoline or like fuel gases, even cleaning fluids, thinners, even steroids. All these things can be the drugs which are commonly used in India as substance abuse. So, as you were asking about the contributing factors, the main contributing factors for substance abuse is social factors and psychological factors. Under the social factors, generally it is seen that because of the curiosity, the adolescents try to taste the drugs, and initially they start tasting it and then they become addicted to it. The drug influences their entire life. So it is initially due to curiosity or adventure they take it, and also sometimes because of the peer group influence they try to take these drugs, or because they because of family circumstances, parents, the father, mother, all are drinking or consuming the substance. These things also can, the children, adolescents can also take in. Then when there is easily available for the adolescents and accessibility is there, then also they start consuming the drugs or alcohols. Then like social practices, like in the weddings, and outdoor parties, the things are easily available. Sometimes they rebel against the authority. Sometimes when it has been said not to do certain things, they want to do it. The adolescents want to go the opposite way and do the things. So that is against the rebel of the authority also. They want to go and try for certain things. Then sometimes because of the diverse separations, people start consuming the drugs. The psychological factors, like when the person is emotionally distressed or emotionally broke down due to financial loss, or because of the marital problems, the person start taking the drug. Then it can be because of the stress level, when the person is having any type of stress the person is having, then sometimes even if they are not able to cope up with the stress, then also they start taking these type of drug. And to relieve the boredom or loss of loved ones, these are some of the psychological and social factors which are contributing to substance abuse.
So elaborately, Dr. Daisy has stated about the various factors, and in that, what I feel is that the adolescents, it is a stage where they are always trying risk-taking behaviors. They are always a victim, falling a victim to this risk-taking behavior, and their curiosity that until they do, then only they will realize what is happening. So in such cases, we can see that several consequences will be there. Could you please explain about the various consequences of substance abuse among adolescents?
Yeah, there are various consequences. This also we can divide into three, like physical consequences, social consequences, and psychological consequences. Physical consequences: after taking these type of drugs, the persons, they are drowsy. Because of the drowsiness, they may have frequent falls, frequent accidents can occur, and even they may have the eyes turned red in color, blackouts, hyperactivity may be seen, irritability is seen. The child may have weight loss, sometimes tremors in the hand and leg, and they may be neglecting their personal hygiene. Even they may have bad breath, dry mouth. Even their vital signs will be altered, like rapid pulse, rapid heart rate. Sleeplessness may be seen in these type of adolescents who are consuming substance abuse. They may have an even intoxicated appearance may be there. Even their looks may have an intoxicated appearance. The female who consume drugs during her pregnancy, she may have even premature delivery also. Even the fetus is getting affected because of these type of alcohol abuse or drug abuse. They may have fetal alcohol syndrome. That is the child, the newborn which is born maybe with mental retardation or with brain damage or may have impaired growth. So this type of problems can occur if the person is consuming the alcohol or other drugs. Then the psychological causes, like they can be anxiety, nervousness, depression, hallucinations may be there, like they are hearing some untoward noise or illusions, maybe their auditory hallucinations, tactile hallucination, visual hallucinations. Then they may have euphoria, maybe they either sometimes they may be feeling very great joy, may be there, sometimes very may feel like having a depressions, and sometimes they feel after taking the drug they feel that they are having a sense of well-being, maybe experienced. So these are some of the then social causes are, as I have said, they may have drowsiness, frequent falls. These things may lead to accidents. Automobile accidents can occur. People can go for prostitutions even when they want the money to buy the drugs or alcohols. They can go for robbery. They may have loss of social status, even may remain absent from the work. Because of remaining absent from the work, they may lose the employment. Financial difficulties may be there, and have divorce or separations because they are not able to maintain the family relationship properly because of this substance abuse, and may also rebel against the authority also, because and even they can even go to that extent that they may feel like doing the suicide also. So these are some of the major consequences which can occur due to substance abuse.
It is always stated that prevention is better than cure. So in this context, could you please suggest the preventive measures to be taken for this issue, substance abuse?
Yeah. First of all, the adolescents should know what is the danger of these consuming these type of substance, these type of drugs. If they consume, what is the adverse effect? So we have listed out what are the various consequences. So we have to list them down and make them aware that these are the dangers which can occur. And also it is important that we have to tell the people that they have to comply with the drug, which normally they may be getting certain drugs which are being given. They have to adhere with the medications which have been prescribed by the medical practitioners. And also it is important that whenever there is any and also important that they have to have a regular consultations with the health care workers also, so that if whenever there is any mental health problems are there, they are able to seek proper medications, they are able to get it. And also they should avoid bad companies, because as we have said, the contributory factor is peer group also. Bad companies also should be avoided. And even it is important that adults should not send children to buy cigarettes, alcohol, drugs from the market, because these also get sent, because these children become accessible to these type of substances. So then they start, out of curiosity, they start consuming the things also. So adults, we have to see that we should not send the children to buy these things. Also it is important to seek counseling when from a trusted counselors also. And also it is important that proper enforcement should be there regarding the availability of narcotic drugs. There are certain drugs are there which we have listed out, like certain morphine, opium. These for the availability of these drugs in the market also, there should be a proper enforcement. Easily it should not be available. It should be available only through the prescription of the medical practitioners. Then it is also important that the regularities, a proper law should be enforced to regulate the availability of use of alcohol in the social functions and other things. And also there should be strict punishment for the drug peddlers, and parents also should be always inquisitive about the affairs of their children. They should know what their children are doing.
So already you have stated about different preventive measures. As teacher or as a parent, what are the measures or what are their role in this issue, in handling such children?
Yeah. First, let's talk about the parents' role. It is very important that parents should see that they get involved into the affairs of the children. They have to spend some time with the child, so that they create an environment at home that where the children can easily open up with their parents. For that, they should be eating together and talking with them, and so that the parents are able to know their interests, their hobbies, and they are able to know what the children are doing. Also, it is important that parents should have a good communication with their adolescents or with their children. That also in the communication means they should be verbal and non-verbal communication. Both we have to give importance to. In non-verbal communication, the parents should be aware, watch out for what are the various clues, whether the child is having red eyes, whether person is drowsy. All these are some of the non-verbal cues you can observe for. You have to listen to your child and also give full attention when they are talking to you. When they are talking to you, look at their children's eyes and talk to them, so that they say that yes, their parents are spending some time with them to communicate. Also, it is important that appreciate and encourage the children, that they are able to discuss any affairs with their parents, so that they feel themselves wanted by their parents, and always encourage positive behavior in their children. Always appreciate their achievements and help them to make their own decisions. Try to improve their decision making skills, and also encourage them in healthy pursuit like sports, music. Encourage them to in these type of activities also, so that you are able to make them divert their attentions into various things. And also it is important by parents to set up acceptable rules. You have to lay down a set rules for your home, and that rules should be set up in consultation with your child, so that it is acceptable both to your parents and to the children. Then let's see the role of teachers.
Yes.
Because the adolescents spend quite amount of time with the teacher in the school. So teachers also are able to identify their signs, their emotional and physical signs. So they are also able to know that yes, if something wrong with the child, they can report it, and effectively we can handle the child. So the role of teachers are to identify the emotional and physical signs, and it is also important, don't jump to the conclusion that the child is abusing. So it is not, you have to find out what is the reason of it first. The emotional signs which you can observe for is if the child is having mood swings are there. Like sometimes they are having a withdrawal, depression, anxiety, this type of mood swings. If it is there, you have to identify. Then without any reason the person is getting angry, or there is no interest in carrying out the curricular or extracurricular activities if the child is doing, or not getting well with the other children, or falling grades, like is not performing that well in the school, academic performance are not good, then even short attention span. So these are some of the emotional signs a teacher can observe for. She can also observe for the physical signs like red eyes, tendency of falling asleep in the class, slurred speech, inattentive in the class, forgetfulness, or neglect of personal hygiene, and or trembling or uncoordinated movements. These are some of the emotional and physical signs a teacher can observe in the child. If these type of signs are being observed, we have to report and we have to counsel that, find out what is the problem. So teachers should be alarmed with and try to identify the problem in the child. Then the teacher should be able to identify the type drugs, and also inform the children that what is the ill effect of these consuming these drugs, what is the negative effect of consuming these type of drugs. In the schools, teachers can organize various activities like on prevention of drugs, and they can be having certain dramas, interactive games, and role plays. All these things can be organized. Even they can also design some t-shirts having this slogan of prevention from drugs. So all these things will encourage the children to prevent themselves from these type of substance abuse.
So Dr. Daisy has elaborately explained about the causes, how we can prevent this substance abuse. Another contemporary issue that we can see among adolescents is the growing number of these adolescents who are affected by sexually transmitted diseases. And when we state about the sexually transmitted diseases, certain abbreviations like STD, STI, and RTI we are using. Could you please explain or differentiate among these abbreviations?
Yeah. Yes. Regarding the STI means sexually transmitted infections. Infections are spread from one person to another person when they are having the sexual contact. So when the infections are being spread, it is termed as STIs. These STI, that is the symptomatic STIs, are said to be STDs. Means symptomatic STIs are termed to be disease, that is sexually transmitted disease, because all the symptoms land up into the disease in the adolescents. Then it is reproductive tract infection. When the infections occur in the reproductive tract, either it is because of the improper personal hygiene or because of the poor sterile technique. Poor sterile technique means sometimes when we go to carry out certain interventions in the hospital in the reproductive tract, if the proper sterile techniques are not being used, then it can even land into reproductive tract infections. So these are some of the terminologies which are used in this, that is STIs, in sexually transmitted infections, STDs, sexually transmitted disease, and RTIs, reproductive tract infection.
So we have seen the difference between these abbreviations, and when we looked at these sexually transmitted diseases, there are various factors why this is happening. Could you please elaborate upon the factors that are affecting this STI transmission?
Yes. The main factors are either it can be biological factors, social factors, or behavioral factors. So once we are classifying into these terms, it is easy for us to remember. That's why I have, in most of the things, I have classified into different sections. So in under the biological factor, when we say it as age, younger the age, more vulnerable the adolescents are. So more vulnerable, or there is increased chances of getting STI infections. Or when among the gender, the females are more affected for sexually transmitted diseases. The reason is that the reproductive organs, because anatomical placement of the reproductive organ for a females, it is internally, not like the male. And plus, because of that, it is very difficult to self-examine the internal structure. That is why it becomes more the infections are being, like once the infections occur, and then the reporting becomes very late in the females. That's why it becomes very severe in the females. And among the females, around 50% of STIs are asymptomatic. The symptoms may not be seen so much outside. And the white discharges and all, generally it is taken as normal. That is also wrong. It is important that whatever the abnormalities have been seen, that it should be immediately examined for. Then the immune status. A person's immune status, if it is low, then there are increased chances of having STIs. And if there is a good immune status, then there is low chances of having STI. So these are some of the biological factor of having STI. Then is the behavioral factor. In the behavioral factor is that the sexual behavior. If the person is having unprotected sex, then there is increased chances of having STIs. And if the person is having sexual relationship with multiple partners, again there is increased chances of having STIs. Then because of the drug abuse, alcohol abuse, again this also predisposed to higher risk, because the person may not be in his or her conscious sense, and they go into the antisocial activities and they encounter the STIs or sexually transmitted infections. Even the partner's behavior also can affect. If the partner is having multiple partners or injecting drugs, these things can cause increased chances of having STIs. And even the lack of knowledge, if they don't have proper knowledge. The social factors are the poor, homeless are more prone to sexual abuse or violence. And the men who are reluctant to use the condom, they are also exposing more of sexually transmitted infections. In low status women among the societies, that they are also having, they don't have much say in the society. Maybe they are also being subjected to repeated sexual interactions. Because of that, there are increased chances of having STIs. Then because of the limited access to the healthcare facilities, when the healthcare, the people, one reason can be because of the social stigma, they don't want to reach to the healthcare facilities, or sometimes the healthcare facility may be far away, they are not able to reach to the place. So these are some of the problems, social problems, which can cause the STIs.
So we have seen various causes under different heads, and another one, how can we identify the signs and symptoms of this STI?
Yeah. In the signs and symptoms of STI, more or less in male and female, almost the same. Both may have ulcers and sores. Discharges like urethral discharges may be seen in male, and vaginal discharges may be seen in female. Then swellings may be there in the groin, scrotum for male. For the females, they can be in the swelling or growth can be seen in the groin or on the labia majora, minora and all. Then burning sensations can be there while voiding, and here also females also can have burning sensation, and even low back pain, low abdominal pain, all these things also can be presented with.
So here in this context also, what are the measures to be taken for the prevention and management of STIs?
Yeah. Also, I just want to say the complications.
Yes.
It is because the complication also we have to remember that due to STIs we can have pelvic inflammatory disease. This pelvic inflammatory disease can land up into infertility also. So that's why the treatment immediately a person should seek medical advices if the person is having STIs or STDs.
So the preventive measures, what measures we can
preventive measures we can have like we can have teaching and counseling regarding the prevention of this disease. For that we have to have prevention, primary prevention mainly will be aimed for the prevention of STDs and pregnancies by abstinence and postponing the sexual involvement, use of condom, and demonstrating how to use the condom also, how it should be applied and how the removal of the condom should be done, and proper regular health sexual health checkups are also very important. Then along with that, we have to have a proper clinical examinations are to be carried out. In the clinical examination, we have to ask for the duration of the problems, the sexual history, the clinical history, and also examinations are to be carried out for of the genitalia, pelvic region, mouth. And whenever we are doing these type of examination, we have to be non-judgmental. Confidentiality of the individual are to be maintained, and privacy of the individual to be maintained. It is also important that they should be getting appropriate treatment. Therefore, they have to seek proper treatment from a licensed practitioner. No self-medications are advised, and complete the course of treatment. It is not that once you see that yes, once the pain is reduced, you stop the medication. No, you have to complete the entire course of the medications, not stopping the medications as soon as the symptom disappears. Discourage sharing the medications also. So these are some of the appropriate treatment. Even there are certain government initiatives are also there. Certain government initiatives like government have opened up STD screening centers are available, where the people can go and screen themselves. They are conducting STD and HIV testing areas are there. Even mobile units are there where it conducts the testing units. And even there are health fair or health melas are being conducted for educating the adult on STDs, HIVs, even collaborating with the health adolescents organizations for conducting the screening camp in the schools also. So these are some of the government initiatives they have been taken.
So another common issue, we cannot say it's common, but when we go through the media, we can see that the news are coming about the suicidal attempt of adolescents or children. Could you tell what are the reasons behind it? And there are different types of suicide. You can highlight that one also. and what are the risk factors behind taking such attempt by the adolescents?
Regarding the suicide, yes, suicide is a major national public health issue in India. According to the record of 2022, it is seen that around 1,71,000 suicides have been recorded. And it is seen that as per 1,000 population, which was recorded in 2019, there was a significant increase in the suicidal rate. That is from 6.5 to increase to 12.4 in 2022. So it is seen that it is a major issue, and it is a major issue among the adolescents of 15 to 29 age group, and it's a global issue of it is an issue globally. Regarding the suicide is an act intentionally taken up to cause one's own death, or we can say it as suicide is a self-directed injury with the intent to die. They can be suicide attempt or suicide ideation. Suicide attempt means generally it is non-fatal, self-directed, potentially injurious behavior with an intent to die. Ideation means you are planning, you are thinking of considering or planning for a suicide. As you have asked for the types of suicide, there are various types are there. According to Durkheim's theory of suicide, there are 4 types of suicides are there. That is egoistic suicide, when the man becomes socially isolated and feels that he has no place in the society. He wants to destroy himself. Like he is losing his own ego, or a self-centered person is losing everything, so he wants to destroy himself. That is called as egoistic suicide. Altruistic suicide, when the group social group involvement is so much that the expectation from the group is so high that they are ready to sacrifice themselves. That type of suicide is suicide bombers, which we have seen also. That is type of suicide is altruistic suicide. Then anomic suicide is, it is carried out during the periods of considerable stress and frustrations, when there is a financial loss is there, the person goes into a severe stress, then they try to commit suicide. Fatalistic suicide is because of the over-regulation of the society, because the society wants the certain regulations, they are to be followed. For example, marriage abuse. The society wants that the daughter-in-law should bring so much of dowry, and if it is not being brought, the abuses are being carried out, then they start committing suicide. That is the abusive marriage. These type of suicide go under the fatalistic suicide. Then the risk factors of suicide. The risk factors are generally among the gender. Men are more prone to suicide. They kill themselves 3 times more frequently among the men than in women, whereas attempt of suicide is more in females than in men. Ethnicity, Indians have the highest suicidal rate, followed by Chinese. Among the religion, highest among Hindus, followed by Buddhist, and lowest among the Muslims. Regarding the marital status, it is seen that among the diverse and separated, it is high, followed by the widowed. Then among the physical health, those who are having chronic illness, those who are having medical problems or terminally ill, they have higher chances of committing suicide. Then mental illness, also due to the mental illness also, there are people, they start committing suicide. The other reasons can be like unemployment, sense of hopelessness, even they can be fantasy of reunion with the loved ones. That also can be a reason of committing suicide, or physical abuse or aggressive behavior. So these are some of the risk factors of suicide.
In a classroom, we can see that a lot of students are sitting. So as a teacher or as a parent at home, how can we identify the suicidal tendencies of adolescents?
Okay. So it is important to identify the warning signs. The warning signs like, now I cannot go alone, or everything is done for me, I want to end. Some words like this also we have to alarm with. We have to also observe the adolescents, that whether they are becoming withdrawn, depressed, or their behavior are indifferent. That also we have to be alarmed with. These type of change of behavior, changes in attitude, changes in appearance, changes in the grooming, all these things also can be a warning signs. Sometimes they put the things, everything in order. Sometimes they may be writing a will that yes, I want to commit a suicidal note. These things we have to see. All these things should be taken as a warning signs. Even sometimes they may be crying, erratic mood, constant crying, or self-mutilation. This can be a warning sign. Or they often don't want to talk, that they want that nobody is they are trapped in this world and they don't want to talk anything. Their loneliness, all these can be the warning signs.
So we have seen the warning signs also, and why this type of attempting suicide is coming. Another one, could you throw a few light on another issue, that is internet addiction? So what is that one?
Okay. Internet addiction, mainly it is characterized by uncontrolled urge to use internet, which is leading to excessive time spent online and neglecting important responsibilities and relationship or personal well-being. When they are spending maximum time on these, then it is called as internet addictions.
So we can see that this internet addiction is also one of the factor, that contemporary issues that we can see among the adolescents. So what is important is that as parent or teacher, we have to take measures to control or to have a habit of using these online tools in a safe manner. So in this session, we have discussed about different contemporary issues among adolescents. Hope that the viewers have identified what are the contemporary issues that is happening among adolescents. And Dr. Daisy has made a good explanation. Thank you for coming and detailing about the contemporary issues. And as teachers, we know that when our own children, they are at the adolescent stage, there is a kind of anxiety in the mind of the parents and teachers. And when we have listened some of the warning signs, how to identify children who are sitting in the classroom or whom we are nurturing upon. So let us have taken a good effort in handling or in the prevention and management of such type of issues among adolescents. Thank you.